about how that all went. I think we had so much demand that it caused some challenges, and I'm really sorry. I'm just checking to see if Lieutenant Governor Bysewicz is still on the call.
Sound is good. Can hear you.
And also, is Dr. Lynn Sosa on the call? Okay. While we reach out to them, which we will work to get them back on the call, I know that you could not hear Lieutenant Governor Bysewicz, but she was really thanking you for your service, and I want to reiterate that. And I really apologize about the technical glitch. I think it shows exactly how much interest there is in this issue of childcare in Connecticut, and also questions for the Office of Early Childhood that are critical for you as you do your job. These are certainly unprecedented times. Childcare is a critical partner with our infrastructure. With this pandemic, we have an evolving situation, and I think one of the most important things we can do is keep communicating with you. Hopefully you've been receiving our memos, memo 1 through 7 at this point, with memo 8 getting ready to come out today. And we also worked on a public information flyer that we sent out broadly, both through social media to families and to providers as well. At this point, I know that COVID-19 is posing challenges to you in the field of early childhood, and we are a field that faces many challenges, period. Some of you have chosen to close your program. Some are open, and many of these are individual and town decisions. Those of you who are open, we have worked to provide guidance from the Department of Public Health and the CDC about screening, group size, and good health practices. In memo number 7, we sent out specific information about public health practices working with our Department of Public Health. And also, we have a new recommendation, which I imagine many of you are following, which is to have group sizes of no more than 10 to 12 whenever possible. I'm issuing this as strong guidance. The governor and I and Lieutenant Governor are very grateful to those of you who've been able to stay open and serve our critical workforce, that is healthcare workers, first responders, and others. You are on the front lines of the effort to save lives. Hospitals are extended to capacity, and things will get worse before they get better. So those hospital staff are critical, and they will be more critical in the days ahead. Nursing homes and state facilities are also facing challenges, as are our first responders. They play a critical role. Early childhood is not used to being out front during a public health crisis like this. And so the governor wanted me to be sure to express his gratitude for those of you who've been able to stay on. 211 Childcare has been a critical partner in these efforts. We're grateful to them, and we are also pleased to communicate with them. Please do communicate with them about your opening and closing. That way they can direct children and families to programs that are open when the parents have to work. I want to just walk through some of the guidance that we have sent out to the public and to you on this call before we take questions. One is that our communication with parents, there are many parents who need to work, and safe childcare is essential to them. We first advise them to look to trusted friends and neighbors and family members who are not in a high risk category to fill in for childcare for them. And when they're looking for support, it's important that they ask the questions about, has a person traveled to a level 2 country in the last 14 days? Have they had contact with anyone who has been diagnosed with COVID-19? And do they have any symptoms of a respiratory infection? We want parents to check in with the individuals that they may choose to watch their children during the pandemic. We also are asking parents to tell their providers if their child is not attending, because for those of you that are staying open for those critical workers, you will know if you have spaces. Additionally, as I said, we're relying on 211 info line. And what we're asking providers to do in connection and work with Department of Public Health is to check children's temperatures when they arrive. Secondly, to increase your routine sanitizing on high-touch surfaces and continue to do that. I know you're all fans of frequent hand washing, but even more frequent right now. As I just spoke about, maintain small groups in one space, trying to stay at 10 or below. Avoid touching your eyes, nose, and mouth, and make sure that any children or adults who are feeling sick stay home. So those are my overall communications at this point. I just want to walk you through the responses that we have made at the Office of Early Childhood. First of all, we've been working very hard through the emergency service functions of the Unified Command to make sure that we're getting information out to you. That same information goes to the statewide website, so all residents have access to that. I will tell you, I'm learning a lot in this Unified Command structure with the governor at the lead and Josh Jabal. And then we are part of the mass care response to this crisis as Childcare. So first, we've been sending out information, and we want to hear from you if there's other information you need. Secondly, we have waived more than 20 childcare licensing requirements to try to help you with some of the challenges you're facing and help providers in places like nursing homes be able to quickly assemble care for children. We had a teletown hall with family childcare providers on March 16th. We had a teletown hall with purchase-free providers on March 18th. We have this call today. We have a call with home visitors the week of 3/24. And we've also have very specific focused efforts to support healthcare staff and first responders. So I'm just going to pause here again to see if Dr. Lynn Johnson or the Lieutenant Governor, Dr. Lynn Sosa, as some of you know, Lynn Johnson is the head of the Child Care Bureau or Undersecretary for President Trump. But I'm wondering if Dr. Sosa was able to get back on the line. And if not, we will collect your questions for her. Dr. Sosa, are you on the line? Okay, we will collect those questions, and we are sorry. As I said in my intro, for those of you that could hear me, she had very limited time to be with us today. So I also urge any of you who want the most up-to-date information to go to ct.gov/coronavirus and then to the CDC website for more information. I just want to say once again what a critical role you play in caring for families and children. And we are here to support you, and we want to hear from you. So please, Rachel is going to tell me questions that we have, and I will repeat them and then do my best to answer them. And I have some of my staff here with me, and we will also get back to you as we need. Thank you, Rachel.
Why are certain local health departments able to close down centers? Who has the ability? Health departments versus the governor versus
Yes. The question is about local health departments and their authority, and why are some local health departments shutting down programs and others are not. I tried to say when this call started that this is a very complicated situation and there are no right or wrong answers. One of the most common questions I'll get is, why are child care centers staying open and schools are all closed? These are public health decisions that we are making in concert with the Department of Public Health. Healthcare workers need to be at work, and child care is helping that. At the same time, many parents are keeping their children home, and so the group size in most child care centers is much smaller. Each local health department is also charged with approving your child care centers. They, as you know, when you get licensed, they walk through. And so in some communities, they are making determinations to close programs down. I have talked to the Connecticut Council for Municipalities to get the message out there about why Governor Lamont and the Office of Early Childhood are keeping programs open for those critical healthcare workers. And I know I've had many communications with you all about how you feel that part of your role is to support the families in these difficult times for those of you that are staying open. And so we are trying to encourage them to not insist the programs to shut down, but that is happening in some places. I hope that answers your question.
Should centers be open only to essential workers, not the parents who are home with other siblings? Many are staying open for kids who do not need to be there.
The question was, should centers stay open for non-essential workers? I think each program has to make its own decision about staying open or closed and consult with the CDC website. There is a decision tree there for schools and childcare programs, and we ask them to consult with local health, et cetera. I think I don't really want to get into who is critical and who is not, and what is critical for a family and what is not. We are working in this office to assure that we have capacity to serve essential workers, and many of you are serving that role. Thank you for that question.
So several questions about getting access to supplies, disinfectants.
Yes. So that question is about supplies. This is really a challenging situation because programs are trying to follow the public health guidance that we are sending out. There are two answers here, and we will also follow up with you with the communication about this. The Office of Early Childhood, as part of the Unified Command, has identified these shortages, and we have put into the Unified Command that there's a shortage of hand sanitizer and soap and thermometers, and we have asked them to reach out to a supplier so the Office of Early Childhood can work to get those supplies and then figure out a plan for distributing them. At this point, based on listening to the statewide calls, there are shortages all over the country in some of these items. And on today's call, there was an issue. On today's call this morning, there is an issue coming up where people are donating these kind of essential supplies to a central warehouse for Connecticut. And so what we are exploring as part of the mass care unit and the child care unit under mass care is, can the child care programs that have closed share some of their supplies with those that are open? And so that's very much in the exploratory phase, but our experience with child care is that people are very collaborative, and we're working out a way that you can support each other. But we have put in this request as essential supplies to support the public health workers.
What kind of guidance can you offer to programs for families that don't want to pay? Why do families should continue to pay?
Okay, this question has come up a great deal too about parent payment. We've been receiving calls from Consumer Protection, the Attorney General in this office, from families and from programs. What we are advising parents when they contact us is to look at their program policies. As part of licensing, we require that programs make those payment policies clear to families, and very often those policies do state that during snow days, et cetera, parents still pay. This is an unprecedented situation, and it's difficult to know how long this will go on. We recognize that, child care businesses are fragile, and we know you're all trying to do what you can for your employees, some of whom are now on unemployment. So we appreciate that feedback and know that we are trying to give the communication that they should look to your policies.
So,
sure.
So items of care and non-specific will care for kids who believe for children whose parents choose to keep them home.
The question is about care for kids, and will parents receive care for kids if parents are choosing to keep their kids home? Will programs continue to be paid for parents who are choosing to keep their kids home? If you have paid for one day, if a child is attended for one day in the month of March, for example, right now, programs will continue to be paid. We are about to put out a memo on this, memo number 8 about state-funded programs. I believe that'll be out at the end of the day. It has not been approved yet, but we wanted to get clear information to the field about payments. I also know that the Office of Early Childhood is working with the Office of Policy Management to get clear guidance about April out as soon as possible. We have not gotten that assured yet, but I know that the Office of Policy Management is concerned about this issue, as are we, and we are working to resolve that work in combination with our work with the feds.
How do we handle conflicting sites about what we were saying about size of programs versus what advisory boards or public health departments might say for both centers and childcare?
The question is how to deal with contradictory information from the state and local health departments. As I've said, I learned something right now, which is that a pandemic, the word has the idea of pandemonium in it, is that there is an amount of chaos, and I'm sure you're feeling it in your everyday lives. And the way the United States is set up is we have local governments, county governments, sometimes state governments, and federal governments, and they all have different authorities, and they're all trying to digest the information, I believe, to the best of their knowledge. I would say that the guidance from the Office of Early Childhood and the guidance of local health departments is, for the most part, in alignment, that we are relying on the CDC guidelines and our State Department of Public Health. And we're posting our information in guidance on our website, and hopefully you can access that easily. But because it is complex, it's different. And one other thing I want to say is, if you look at that guidance, that the guidance is not always 100% clear, but that the guidance can be different in one community than another based on any documented cases in that community. So, a Westport health director might have very different guidance than the director of the Stores health district.
Guidance for programs that are 501c3 and cannot apply for unemployment.
Guidance from programs that are 501c3s and cannot apply to unemployment. I don't believe that's accurate. I believe that if you have an employee who works for the state of Connecticut who has been laid off, they can apply for unemployment.
Are we issuing any guidance around playgrounds? Do we have guidance around?
We do not have guidance around playgrounds in public places. We've been very focused on our birth to 3 providers, our home visiting providers, the Office of Early Childhood programs, our licensed programs, and also collaborating with the State Department of Ed on some of the places we intersect. So we have not issued guidance about playgrounds.
For programs remaining open, how should we communicate that to 211? And is there any expectation around communicating for kids and come in, adults come in?
Yes.
Without the threat from others?
That question, can you repeat the question, Rachel?
For programs
For programs
remaining open,
that remain open,
how can we communicate that information?
how can they communicate from 211? This is really important, because those of you staying open are really critical for some of these public health workers. You can call 211 Childcare and let them know. And we apologize if you have had lots of calls from our office and surveys about openings at your place. We are directing first responders to 211 Childcare, as well as healthcare workers and hospital workers. So that's how we are communicating, but you can also feel free to update 211 on your status. We are asking that you screen children when they come in for any signs of cough, cold, runny nose, and that if possible that you take their temperature. We have reached out for supplies. We asked the Emergency Operations Center to please put in a request for 800 thermometers. And so we will update you as those become available.
Updates on subsidies, school readiness, and CDC subsidies for April.
Can I just say one other thing that someone here at OEC just reminded me of, that as part of your license, we have thermometers as a requirement in your first aid kits. So you should have some, but we recognize there's a need for more, and they seem very difficult to come by right now. Yes, Rachel, go ahead with the next question. The question is, do we have updates about April for CDC and school readiness? We do not. That, like Care for Kids at OEC, and I know at the Office of Policy and Management, we are considering this, and there is definitely a great sympathy to get there. We just haven't gotten a final guidance yet, but today we'll be sending out Memo 8, which will have the most up-to-date information about state-funded programs. It will have information about payments, about reporting, and about quality assurance requirements. I'm really grateful that somebody asked us, will we be looking for emergency funds? I have to say that if one thing is coming out of this crisis, is that the whole country is recognizing that childcare and early childhood education is part of the backbone of our communities and our societies, and we are helping to hold it together. We've been very concerned about the economic fallout because childcare centers as businesses are terribly fragile. We put it all into the kids as a culture, and so there's not a big savings account in anyone's bank. So we have been in touch with the Department of Economic Development. Margaret Gustafson's from our office has been appointed to the Emergency Support Function Economic Recovery, and she is representing the challenges that child care programs are facing. And I would like to direct programs right away who have concerns around this to look at the Department of Economic and Community Development website. They have guidance for small businesses because you are small businesses in your communities and you play a critical role. So we are definitely at the table in all discussions around economic recovery, and you are not being forgotten.
A couple questions about waivers for school readiness, the 51-week requirement.
Yes.
If they don't get NIAC accredited by their expiration date, can they get a waiver? So how are they going to handle some of the other expectations?
I'm glad that you're asking this. Some of this is covered in Memo 8, but I'll also say that Memo 7, we have already waived the 51-week requirements. On Memo 7, we list all of our waivers. Some are around letting youth camps operate starting immediately, even though it's not summer. We also have some exemptions around health and immunization records to allow for speedy enrollment for first responders. Some are around staff training and CPR. We understand how challenging that is, as well as the head teacher requirements. The health consultant visits can be done over the phone. Staff physicals, we'll recognize any that exist, even if they've expired, if they expire during the state of emergency, and other such items. And there are more waivers to come. I know that committee met today, and we want to hear from you if there are requirements related to school readiness, CDC, or licensing that are getting in the way right now, particularly because of the coronavirus.
Is it 10 to 12 in the whole building or 10 to 12 in each classroom? They have 4 classrooms in the building.
Is it 10 to 12? Oh, the question is it 10 to 12 in the building or 10 to 12 in each classroom? I'm so glad you asked this question because I know some health districts are limiting programs to the size of 12 per program. Our recommendation is to have no more than 10 to 12 children per classroom. In Connecticut, the square footage requirements are 35 square feet per child. Given and you cannot count on kids to social distance, I know, but we can create more space. And I know that enrollment is down in many programs, and we're hoping you'll use that to create space between children versus to consolidate. classrooms. And we'll have a very specific recommendation coming out to you around group size very soon.
Health consultant is asking whether we'll have virtual med, EpiPen, first aid, and CPR classes in the future, virtual.
The question is around EpiPen, MedAdmin trainings that could be online. We will look into that, certainly. I appreciate that question.
Many have asked just about the staff, worry about their own staff.
Yes. Yes, and I will tell you, as Commissioner of the Office of Early Childhood, this question weighs very heavy on me. The question about the health and safety of our directors, of our staff, much as I'm sure hospital staff are feeling right now and first responders are feeling right now. That's why we sent out very specific guidance about what things that you can do to prevent the spread of the coronavirus. But certainly we understand that worry. There is no perfect answer to this question. It's sort of beyond that. At this point, it's part of the public health response. But we do believe very strongly that you're sanitizing, hand washing, keeping smaller group sizes is part of that response.
Is it possible for childcare centers to not serve essential workers?
Is it possible for childcare centers to not serve essential workers? Yes. Our governor has not issued any guidance around who childcare programs can serve. The idea of him working hard to keep them open is to make sure that they're available to that population. But as I said earlier in the conversation, what is essential and non-essential to a family, to a community, to a state is hard for any one of us to know. What we know, I know our response is grounded in the staff who are responding to this crisis.
Will payments be delayed in any way?
Will Care for Kids payments be delayed? At this point, nothing has changed about the timing of Care for Kids payments. United Way is on the same schedule they were on 6 weeks ago in terms of getting those payments out. If that changes, we will let you know. I just want to take a minute to thank 211 United Way for their partnership in this public health emergency. They have been helping in many ways, and also know that they're available to you for questions around childcare, but really any questions around COVID-19, they have 211 you can call with those questions, because this goes well beyond your business. I know this is affecting every part of our lives, and I'm grateful to have the support of the staff at OEC who, despite some of their own concerns and health concerns, have been working incredibly hard to communicate with you and keep things moving so we can be supportive.
Two good questions. Considering opening a new site for either family home or center to either serve critical health workers or others, are they following the same licensing expectations to open a new site?
Thank you for that question. The question is opening a new family childcare home to help in this emergency. Yes, we are following regular licensing rules. I will say our licensing staff have been incredible as hospitals and nursing homes have reached out to us to be supportive and creative, and it has informed some waivers. But I think particularly for first-time family childcare homes, just know that we will work with you as you work to get open.
They don't have enough staff to stay open, but can staff care for children in parents' homes?
The question is, a program cannot stay open, but can their staff work for parents in their home? So I think that the answer to this question is that you as director hire that person as an individual. If that individual chooses to contract formally or informally with the family, that is their decision. That is not your decision. I just had a staff member just take note. Take note if you have program policies that forbid this, that could be different, and you would need to make sure you reminded your staff member of that, or you would say, I waive that in this case. Again, I don't think there's anyone on the line here that doesn't want families to have what they need, and people are making very difficult choices about staying open or closing, and we understand that. Okay, more questions about financial help. Again, I don't think it hurts to repeat. The Department of Economic and Community Development, they have a website with information about how businesses can get help post public health crisis. And I would also say that please do let them know that you're having challenges and that you're worried about your business surviving this, because if they hear from our industry, they'll realize how many of you are struggling. Yes. Do we know how many programs are open or closed? We do have some survey information from the United Way, but like everything, I'm going to just keep saying things change every day. The guidance from our office could change tomorrow on some of these issues I'm talking about related to public health. And yes. Sorry, I don't mean to say yes to you all. I'm just getting information as I'm speaking. We do know that as of yesterday, based on a survey of 211, about 30% of centers reported they were open, 30% reported that they were closed, and 30% had not answered the survey. In terms of family childcare homes, the vast majority of those were open. We are getting new data every day, though, and it's changing. We are almost out of questions. If you have another question, please let us know.
Questions about positive test cases, and should they notify us, or how do you know if they hear about positive test cases in their parents?
If there is a positive test case in your parent or family community, you should contact local health. And if you please check memo 2, that is a reportable event. Hold on, we are pulling up memo number 2, and that's on our website. So it says, those required to report diseases must report cases of COVID-19 immediately to the Connecticut Department of Public Health and the local health department in the town of residence of the case patient by telephone on the day of the recognition or of strong suspicion of the disease. And this is all accessible at the DPH website, Department of Public Health website.
For those who are school-based and follow the closures for the school year, if school closed for the duration of the year?
For programs that follow the school closure rules or school-based, I would say, first of all, on those that follow the school closure, I think a lot of times policies like that are grounded in weather, typical times. These are not typical times. And so I think every program has a right to adjust a policy at a time like this. For the school-based programs, that's really a local school district decision. It doesn't mean you couldn't go talk to the superintendent and say, we run our program in your school. We have a critical need in our community for childcare for healthcare workers. You could certainly take that to your community. We're not the only ones, and the governor's not the only one who's worried about childcare for these critical workers. The mayors and first selectmen are concerned as well. The superintendents are also very concerned. Yes. Yep. If a local health department shuts down a program, when can they open back up? That is really up to the local health department to decide that. And it is worth communicating with them. And if you want, communicate with us. I have had numerous conversations with public health directors about allowing programs to open to serve essential workers. And a lot of times, I think that, one of the reasons I've been admiring Governor Lamont's response to this whole public health emergency is that he is really looking from a high level. We all understand if we watch the news that there's grave concerns that the hospitals are going to be under duress very soon. So he wants to be sure that when that happens, that we have the healthcare workers to take care of people who are going to be very sick. And so it would be easy to just say, let's shut it all down, because that seems very, that seems like, oh, well, just do what the schools do. But it's not that simple. It's very complicated.
I think there's a question about needing more guidance about who is considered essential. So I think when we get to that point, probably.
Yeah, there's a question about who is considered essential. I've tried to answer this a couple times in a couple of ways. Different kinds of jobs are essential for different reasons at different times. And in this, with the coronavirus, it changes. Right now, every one of you would say that a grocery store worker is very essential right now. That might not have been something we would have thought of 2 months ago. So we do not feel terribly judgmental about what is essential here. We know we've been directed to be particularly focused on hospitals, nursing homes, home health care workers, and first responders to make sure they're there to respond to this crisis. But there are other critical workers, both because of the crisis and in our day-to-day lives, who are needing to go to work at this time.
Will initial program inspections still happen for in the child care homes that want to?
Will initial child care inspections go on? Yes, initial child care inspections are ongoing.
Guidance around CASCT and how to support families who need food support so that the program can remain solvent, so providing grab and go or other food.
I'm so glad, and this is so indicative of who we are as a field. Programs worrying about if they are food providers, how children are getting food. I would really appreciate folks should feel free to reach out to our office to let us know if you are a food provider and you are not open and you're concerned about your families, because we are working under the Mass Care ESF 6. We have a representative on the food subgroup, and we are working closely with the State Department of Ed, who is doing an incredible job allowing more and more districts to do grab and go. But we do not want young children forgotten, and they are on their radar because we have been with them. But we do think there are some communities that are being missed, and we think there are some early childhood programs who are providing critical nutrition to their children who we want to know about, so we can make sure that emergency support function has all the information they have to address this concern. Okay. Yep. Okay. I'm getting information that we have answered the theme of the vast majority of the questions at this point, and that the answers to these questions will be posted on our website, or how to get an answer to these questions. We hope that we have answered most of your questions here today. I want to close just by thanking all of you for what you do every day, but for what you're doing right now. A special thanks to the OEC staff, to staff at the State Department of Ed who've been working with us, but to you critical community providers. It's never been more clear what you mean to your communities. And I have been really proud to tell the governor about some of the conversations I've had with you all about how you understand your place in this challenge and how you have been supporting families and children. There's a lot of work to do. We have a long road ahead of us, and we need to be collaborating with you about how we support families in their homes. And we are going to be reaching out to you for your ideas about that. and also if there are ways we can support you reaching out to your families who are home, because those of us who have ever been parents understand it's not easy to be home with your children, concerned about going to the park or concerned about going out. And so we will be switching our attention to this once we have a sense. Right now, we're very focused on assuring a supply of childcare, as you can hear from my comments. So thank you, and we will be communicating again soon.